talking about reduced chances of autism with $25 worth of vitamin D3 per year. Vitamin D is remarkably neuroprotective by raising glutathione levels. I won't get into it now, but glutathione is your #1 antioxidant produced by your body. You can produce more with some vitamin D. I mean, it just goes on and on. I'm going to move on to a couple of other subject matters. Preventable causes of death in the United States. Public Library of Science, April of 2009. April of 2009. We're going to talk about preventable causes of death. Back to prevention. Back to saving money. Back to funding these clinics by teaching these things that I'm going to mention to you right now. Prevention and saving money. Tobacco smoking is contributed to 467,000 deaths in the United States in 2005. Imagine if we got more people to quit or never take it up. High blood pressure, 395,000. What's high blood pressure linked to? Is it genetics? No, it is not. We do not need genetic testing for high blood pressure. What we need is better nutrition and more exercise. Overweight, 216,000. Isn't that the same as high blood pressure? Physical inactivity, 191,000 preventable deaths per year in this country. High dietary salt, too much salt in your diet, 102,000 deaths per year could be prevented if we just reduce our salt intake. Low dietary omega-3 fatty acids, fish oil, 84,000 per year. If we give people fish oil, we prevent 84,000 deaths per year. High dietary trans fatty acids, which is basically processed foods and deep fried foods, 82,000. Alcohol use, 64,000. What's that, 1 million people? Right off the bat, out of 2.5 million people that die per year, can be prevented, and we can save a whole lot of money by having people eat better, get more exercise, take a little bit of vitamin D, take some fish oil. Let me take a couple minutes and get into exercise. Journal of Evaluation of Clinical Practices in 2009. Exercise parameters in the treatment of clinical depression. Now I'm going to get into depression, which tens of millions of people are diagnosed each year in this country. What it's doing is testing the effectiveness of just exercise on how it affects people with depression. A total of 14 controlled trials were included, so they looked at 14 other research articles in here. And what they found is there's an equal volume of evidence supporting that exercise programs, whether you do it alone or in a group. In my clinics, I talked about doing it as a group, and then we can teach people how to do it at home, reduces rates of depression. So we can actually get people to get into remission on depression by just 3 exercise programs per week. Next. Exercise and pharmacotherapy in the treatment of major depressive disorder in the journal Psychosomatic Medicine in 2007. So what they did is they compared the effectiveness of Zoloft and exercise. Which one was kind of better? So in here, 47% of people remissed after taking Zoloft. Okay, 47% got better with Zoloft. 45% remiss, almost the same number, if they engaged in supervised aerobic exercises, which was either walking or jogging on a treadmill for 10 minutes, 30 minutes with an increased heart rate, and then 5 minutes of cool down. So we're talking 45 minutes of exercise, I think it was 3 days a week. So Zoloft helped 47%, an exercise program 45% in a group. Individual exercise programs at home, maybe they don't stick to it quite as well, 40% still got better. Because this was a good trial, they had a placebo. 31% got better with placebo. Okay? Exercise is as good as Zoloft and remissing people from depression. How much money can that save us if we set up clinics around the country, not only for high blood pressure that I mentioned earlier, quitting smoking as I mentioned earlier, reducing obesity, but now we're talking about exercise preventing major depressive disorder, and it works as good as Zoloft. Look at the money that we can save there. Next, Now we're going to move to fish oil and depression. This is the Journal of Clinical Psychiatry in 2009, omega-3 fatty acids in major depressive disorder. Now we're talking about omega-3 supplementation, just fish oil now. Data from placebo-controlled treatment studies, which means it's comparing fish oil to a non-fish oil placebo, suggests that omega-3 fatty acids are a reasonable augmentation strategy for the treatment of major depressive disorder. Now what I propose in our clinics here that we're going to set up around the country that can be funded initially by federal stimulus dollars, with the money that we would save with reduced early death, reduced disease rates in hypertension and diabetes, type 2 diabetes and now type 1 diabetes, we would have supplements available, basically fish oil supplements available, and extremely cheap vitamin D3 levels as well. Another study that talks about exercise and depression among breast cancer survivors. So, breast cancer survivors might have a rate of depression after their survivorship. So now they're comparing and looked at exercise and tea consumption. So this was out of the Journal of Clinical Oncology in 2010. Very, very new stuff. The study was done in China. Results: 26% of women reported depressive symptoms and 13% met the clinical criteria of depression 18 months post-diagnosis. Here's the important point now. Women with a higher exercise level were less likely to have depression than non-exercisers. If you exercise more, you have less depression. It doesn't matter if it's post-breast cancer survivorship or, as I said earlier, just general major depressive disorder. You exercise, you have less depression. That's been pretty well known, but now what I propose is we should be putting our money into the prevention deal as opposed to letting people get diabetes, letting people get cancer, letting people get depression, and then treating it with drugs. I'm not saying drugs are not necessary. I never said that. What I'm saying is, well, let's pump in exercise. That's a good, healthy thing to do, and maybe not only just for depressed people, but for everyone, so then we reduce high blood pressure and all those preventable deaths, and then we reduce obesity and all of those preventable deaths, and then we have people eating better, and that's going to save us hundreds of billions of dollars each year by doing these types of things. The last study that I want to talk about on the show is an association of the Mediterranean dietary pattern with the incidence of depression. The Mediterranean diet, it's going to be non-processed foods. It's going to be high healthy vegetable, high fruit, low grain, and some meat. The Mediterranean diet, it sounds kind of like the Paleolithic diet, kind of sounds like somewhat of the Atkins diet, the Zone diet, all of those diets that are out there, the Ornish diet, and so on. Conclusions: our results suggest a potential protective role of the Mediterranean diet with regard to the prevention of depressive disorders. Now we're seeing that simple dietary changes can reduce the chances of depression. What I propose is we set up clinics around the country, funded initially by federal stimulus monies. They will teach people healthy shopping, healthy meal preparation. It's going to show them exercise programs that they can do in the group and exercise that they can do at home. We're going to supply that with vitamin D and fish oil supplementation. This is also going to create a variety of jobs and deal with what true healthcare is all about: prevention. I'm Dr. Scott Fuller. This is Health Source.